Hi everyone, welcome back. Today we're joined by Dr. Raj Srivastava, Assistant Vice President of Research here at Intermountain Healthcare. Today we're going to be discussing the clinical trials that Intermountain has been involved with and what that process has been like through COVID-19. Dr. Raj, thank you so much for joining us. We really appreciate it.
Thanks for having me. I appreciate being here.
Yes, so what is the philosophy behind research at Intermountain and how is that different or the same during the current pandemic? Has it changed at all?
Yeah, thanks for that. You know, Intermountain has a long history of research where clinicians were practicing in our system and were noticing things that were happening and could be done across the entire system to learn how to do it better. And our philosophy really is to use our model health system that Intermountain is to advance clinical investigation and improve patient outcomes and healthcare quality through innovation, discovery, and implementation science. For us, the pandemic has really allowed us to, like everybody else, focus on what are the questions that we need to answer here at Intermountain Healthcare for our patients and our community, and then worldwide to know how we can treat this virus and the resulting complications it has in people even better.
And Intermountain has always been doing research, right? This isn't something new that happened just because we're in this pandemic. It's been an ongoing process. Is that correct?
Yeah, Intermountain, as old as Intermountain is how long we've been doing research. And we have been, if you look at the 4 decades or so of research, we have done some really cutting edge things by creating our own homegrown electronic health system 20 years ago and being able to answer questions that nobody else could answer. Now a lot of people can answer them because they've got that technology as well. But it's been really good to see how we've been on that cutting edge of what do people need to have answered, and then what can our researchers do to do that. And then the pandemic actually provided a different opportunity for us, which is when we were getting that alarm bells of this new pandemic is coming and how is it affecting our patients, we were able to very quickly pivot and say, well, what are the most salient questions we need to answer now? And let's get on it and start answering them.
So let's talk a little bit about that research. What kind of research has Intermountain been doing with COVID-19 and how have you been collaborating across the state with different healthcare systems on that as well?
Yeah, thanks for that. So about 10, 11 weeks ago, or back in mid-March, when we were all worried about what was coming and we were, just like everybody else, preparing for the worst, probably the biggest questions out there that research was faced with was, we don't have a drug that we know that helps patients with COVID-19. Is there something we could do to design a study to answer that question? At that time, probably the first drugs that people across the world were looking at had to do with anti-malarial drugs that other patients, say with rheumatoid arthritis or lupus, were taking. There was a thought it might actually be helpful for patients with COVID-19. So what Intermountain did in collaboration with the University of Utah, the State Department of Health, the Utah Medical Association, and Big Pharma, was we designed and stood up 2 large clinical trials, one on the inpatient side and one on the outpatient side, in a really nimble fashion. So from the idea to the first patient enrolled, we did it in 14 days. That sort of speed is not something we've done often. In fact, sort of taking 9 to 12 months of work and cramming it in 14 days. But that's because in our model health system, we need to answer these questions quickly. And so we were moving that fast in order to do that.
Yeah, we've seen a lot about different healthcare systems too moving really quickly to get clinical trials up or to figure out the best drugs for COVID-19. And there's a lot of different talk about different drugs that go on for the treatment of COVID. How does Intermountain ensure that it's safe during these clinical trials when we're giving people different types of drugs that maybe aren't specific to what the actual disease or virus is?
Yeah, so one of the advantages that Intermountain has and others that conduct clinical trials, our clinical trials have a whole set of safety checks and policies and pieces to ensure that whenever a patient is being offered them, they're fully aware of what they're getting into. And then when they are being given the drug, that they're being monitored in a way that's even more enhanced than routine clinical care. So for our clinical trials, we have studies where we are following the patients every day on an outpatient basis, checking in with what symptoms they might have, and do they have any progression in their symptoms, and then what help they might need. That allows us to keep a closer eye on patients that otherwise might just be getting a drug from their physician to treat it, but maybe they're not able to talk to their doctor every day for 14 days to find out how things are going.
What's the biggest difference, if there is one, between the inpatient trials and the outpatient trials?
So the biggest difference is they're asking different questions. So looking at these drugs that a lot of people are talking about, these antimalarials, for the inpatient study, really the question is, if we give it to people who are sick enough to be hospitalized, is it saving lives? For the outpatient trial, we're asking a different question. If you've been seen, you've been diagnosed, but you weren't sick enough to be hospitalized and you're at home, does taking this drug actually prevent hospitalization?
Okay, and if someone wanted to become involved with these trials, is there a process for enrollment? Are you notified if you qualify for it? How does someone know that these even exist?
Yeah, so great question. The inpatient trial, we actually have a system by which we are able to monitor all of our hospitalizations and approach the patient and the care team to let them know about the trial and have a discussion if they want to be involved. On the outpatient trial, we also have a system by which people can, they're contacted if they're positive in our system, so we can let them know about the study. And then for people who have heard about it through Facebook or other various sources that we have, there's a phone number that they can call saying, hey, I became positive and I just want to know more. And then they can contact us and email us, and then we can talk about enrolling them in the study.
You talked about Facebook for a second. Let's talk about how people can have heard about different research or studies that are going on, and how you figure out truth from maybe misinformation that's going on. What are some good resources people can use to actually figure out if these studies or the data they're looking at is correct?
Amanda, thanks for that question. It is really hard. And I'd say for me and my team, it's been a full-time job, where right from the beginning, we've been looking at every single medical study that's coming out and assessing, what does this mean? Is this changing things? And one of the things I'd also want people who are watching to understand is we're in a world where most people are staying at home. Everybody's looking at social media, and every single soundbite or piece of information is being perpetuated. And so there's a lot of anxiety around what we're learning. I'd say people should go to trusted sources. So one, Intermountain Healthcare is a trusted source where we are putting out information about these trials. Other universities or funders such as the NIH or the CDC are trusted sources. And one other piece that I think people should take away is if they are confused about what they're hearing about research, they should also talk to their provider, because their provider is also learning about this and can have good conversations and really understand from that patient's point of view if something is relevant or helpful or not.
If you find a piece of information out there, if you're Googling a clinical trial and you stumble upon something, is there a way to know whether what you're looking at is actually backed up or medically, there's a term for that.
Sound,
yes. Is there a way to figure out if what you're looking at is real or if it was put together as like a thought or opinion piece too?
Yeah, that is really hard. I have been fielding calls for the last 10 weeks and even this last weekend where a new study came out and therefore people were wondering, what does this mean? And so a team that here at Intermountain has put together some really thoughtful talking points to help people understand the context. Was that a study or was that an opinion piece? Was it a study that went through, we have what we call different levels of evidence. So generally in medicine, we want to make decisions on the highest rigor quality evidence. Some of these studies that are coming out are not as highly rigorous and aren't as high quality. They're still helpful. They're still important. In a pandemic, we're going to take all the important information, but it does take a little bit of sifting through to figure out how much weight you want to put on one versus the other. And right now, that's what our team is doing. And I know the university is doing that, and other trusted sources in the state are doing that as well to help people understand what does it mean.
especially when you see all of these different things popping up on Twitter or Facebook, or different trusted sources may say something that might not necessarily be true. What should the average person take away from research, specifically with what Intermountain Healthcare is doing?
So Intermountain uses our model healthcare system to understand how to better help our patients. And, I've talked about a couple of trials that we've started to answer that. We've actually got a series of other trials that we're running with big pharma, testing drugs that people have heard about, convalescent plasma, some of these other therapeutic agents that people are excited about. And what I've been really impressed with Intermountain is we have a strategy to test all of the important things that we should be testing to be able to offer our patients. One thing I'd say for people who are watching and want to take away a message about research is we're engaged in it. We want to find the answers with you. It's always up to the patient if they want to participate or not. And thus far, on our hospitalized service, more than half of our patients have been tested on a clinical trial with an agent. So we are really actively learning because the will of people in our community is they want to learn as well.
Last question for you. Because this is so new, it's only been around for the last 4 or 5 months. I know we're learning all of this new stuff. What do you hope to know in a year from now that you didn't know now?
Great question. In a year from now, I would love to know what are the drugs that can help people if they get COVID-19 stay healthy enough that they don't need to be hospitalized. What's the drug regimen that if they are hospitalized that can prevent death for them and their loved ones? And then what are the best vaccines out there that we should be giving people that can protect them from acquiring this infection?
Well, that's great. Thank you so much, Raj, for joining us. We really appreciate it. And there's a lot of information about our clinical trials on our website. If you go to intermountainhealthcare.org and search for clinical trials, a web page about the different ones going on and how you can get involved will be on there. We also still have our COVID-19 hotline available. That phone number is 844-442-5224. You can call, get screened, and then find out the closest testing location to you. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.